I welcome you all on behalf of the organizing committee, 5th International Conference, Shalamar Medical Dental College, on this important workshop on systematic literature review. We decided to conduct this workshop because most of the researchers have many queries regarding this. For this, we have invited our speaker and trainer, Professor Dr. Khalid Mahmood. He is Director, Institute of Information Management, University of Punjab, Lahore. He has supervised many PhD students in information management and has many international and national publications on his credit. He was nominated as amongst top 2% of the researchers, topmost researchers by Stanford University. Welcome, Dr. Please
thank you very
start.
Much. Thank you very much. Bismillahirrahmanirrahim. My name is Khalid, and I'm going to present on systematic literature review. So in other words, particularly in health sciences, it is called only systematic review. So we can use both names. So I will share with you my screen. So Ghulamfreed, recording is on right now?
Yes, sir. Recording on.
Oh, okay, it's good. Ghulamfreed, I have seen a message, host disabled participant screen sharing. So please allow me.
नहीं, participants नहीं कर सकते, simple panelist discussion कर सकते, participant नहीं है, webinar है, उस पर नहीं कर सकते, उनको rights नहीं दिए।
मैं स्क्रीन शेयर नहीं करूंगा तो फिर मैं कैसे आपको अपनी प्रेजेंटेशन दिखाऊंगा? इसका क्या
नहीं, आपको शेयर तो करना होगा ना,
चेक कीजिएगा,
शेयर नहीं करूंगा
चेक कीजिएगा,
शो कराऊंगा और सारा कुछ।
सर अभी चेक कीजिएगा, हो गया,
अभी अलाउ कर दिया ना?
जी सर।
जी अभी देखिएगा, मेरी स्क्रीन आपको नजर आ रही है ना? अभी देखिएगा।
जी सर आ रही है।
प्लीज आप ओके करेंगे ना कि हाँ? अब
यस सर आ रही
देखिए
है।
पावर पॉइंट है ना आपके सामने, चलें।
यस
So,
सर।
Bismillahirrahmanirrahim, systematic literature review, or in health sciences, it is mostly called systematic review. So, it is a kind of type of literature review. So, from which we extract or we reach on a evidence through which we can have informed decisions in our practice. So this is about me. I'm a professor of information management, and nowadays I'm a dean of economics and management sciences faculty at the University of the Punjab. I did my postdoctoral research from University of California, Los Angeles. So I have some publications and I have supervised some students also. So this is acknowledgement. Acknowledgement means normally we do not include citations or references in this kind of presentations. So in the beginning, I am acknowledging the efforts of the authors and presenters and writers of the websites. So I have made this presentation by using many sources. So I'm thankful to all. So first of all, this is the definition of literature review. Simply, literature review is a general term for all attempts to synthesize the results and conclusions of two or more publications on a given topic. So a review may or may not be systematic. So there are many types of literature review. So among those types, I have gathered here only 3 types. So these are actually levels. Levels means by the difficulty level or by the expertise level. So I have divided the types of literature review in three. So first of all, narrative review. So normally in our research, in our empirical articles or in our thesis or even in our proposals, we use narrative review. So narrative review normally is a subjective in nature. So the author can use any articles or studies of his or her choice. So it is not considered as a scientific literature review. So there was a need to develop a literature review method which must be more scientific, and particularly in health sciences. So the evidence should be reliable. So the systematic review was invented or developed. So a systematic review is a review of a clearly formulated question that uses systematic search and systematic and explicit methods to identify, select, and critically appraise relevant research and to collect and analyze data from the studies that are included in the review. So this is considered more scientific, more reliable, and more objective in nature. So there is another type of literature review which is even in its difficulty and in its evidence reliability, it is higher than the systematic review. It is called meta-analysis. So meta-analysis actually quantifies the information. So from different studies, we collect quantitative evidence, the quantitative outcome of the studies, and we use statistical methods to combine the results of various independent similar studies, and at the end we come to a cumulative effect or cumulative result of all those studies. So in meta-analysis, we have to use statistical methods, and there are separate software packages for meta-analysis. So today we will focus on a systematic review part of our literature review. So what is a systematic review? So it is a scientific study. It is a systematic method of literature review. So I have gathered some information on the history of systematic review. So in the beginning, astronomers claimed that they were the first users of this method. But in previous years, there was an explosion of systematic reviews in health sciences. So particularly in 1980s, so the term systematic review was originally coined by the healthcare researchers. And here you can see a chart also. So this graph or chart shows that the exponential growth of systematic reviews in the literature of health sciences. So systematic review became a significant tool for evidence-based medicine. So in other fields, it is called evidence-based practice. So it was a very beneficial, a very useful tool to get evidence from various studies and collect at one place, and you can make an informed decision for your practice. So in health sciences, it is called evidence-based medicine. Systematic review, here is a definition. So look at the definition. I have highlighted some points in this definition. So a systematic review attempts to collate all empirical evidence that fits pre-specified eligibility criteria in order to answer a specific research question. It uses explicit systematic methods that are selected with a view to minimizing bias, thus providing more reliable findings from which conclusions can be drawn and decisions made. So look at the highlighted points. So it collates or it gathers all empirical evidence. So according to a pre-specified eligibility criteria. So in order to answer a specific research question, so first of all, we have to make a specific research question. So after that, we can be able to gather the information, gather the studies. So it uses explicit systematic methods. So the method must be explicit, and it is the demand of the scientific method that a researcher must use the research method or tools which can be replicated, which should be explicit to all. So in this systematic review, a reviewer or researcher also uses a method which is explicit, which is stated in the article. So the purpose is to minimize bias. Means the study, the review should be objective in nature. It should not be subjective. So the purpose is to find reliable findings to make your decisions. Next, I have collected a comparative analysis of a narrative review and a systematic review. So I have taken this picture from a book. You can see that on the left side, there are some points, and in the second and third column, there is a comparison. So the first point is deciding on a review question. So in good quality systematic review, there must be a clear question to be answered or hypothesis to be tested. So you can test your hypothesis even with the help of the literature or studies. So on the right side, in traditional narrative review, it may be a clear question to be answered or may not be. So and normally no hypothesis is tested in traditional narrative reviews. The next point is searching for relevant studies. So here in systematic review, we do a comprehensive search to gather, to collect all published and unpublished studies on a specific topic or to answer our question. But on the other side, in traditional narrative review, it is not necessary to locate all relevant literature. So it is normally not a comprehensive search. The next point is deciding which studies to include and exclude. So in systematic review, there is a clear and stated inclusion and exclusion criteria, but in the narrative review, it is not a practice in here. The next point is assessing study quality. So systematic review, we assess the study quality. We see the potential biases. We see even the methodology of the studies they have used. But in traditional review, it is not common that we see the quality of the studies we have collected. The last point is synthesizing study results. So the synthesis process is again systematic in systematic reviews, but in traditional narrative reviews, the author can do in his or her own way. So there is no specific or scientific method to collate or to gather the studies or to synthesize the studies. So this was a short comparison between two types of literature review or two levels of literature review. So at the end, end of the definitions, so we have seen the history, we have seen the definition, we have seen the comparison. So at the end, we can reach at the list of the characteristics of a systematic review. So look at the points, clearly stated set of objectives with predefined eligibility criteria for studies. So we have clearly stated objectives, or in other words, you can say that there must be a clear research question, and there must be a predefined eligibility criteria to include and exclude the studies in your review. So the next point is explicit reproducible methodology. So I have already said that in sciences, it is necessary for all researchers that they should state the methodology they have used. The next point is systematic search that attempts to identify all studies. So the search must be systematic, and as a result, it should be successful to gather all necessary studies to be included in a review. So the eligibility criteria is before you, and you do a systematic search in the databases or other places, and you collect a comprehensive list of studies to be included in your review. So the next point is assessment of the validity. So this is the assessment of the studies, the quality of studies. So you see the method, other things. So in next slides, we will see some points regarding this. So at the end, the systematic presentation again and synthesis. So you synthesize, you collect the analyzed data and synthesize at one place, and your presentation is again in a scientific way so that a result can be concluded, and it can be useful for future researchers or useful for your clinical practice. So these were the characteristics. Now we come to the steps in a systematic review. So here you will see 11, 12 steps. So first of all, you will have to build a review team to do this task. Then you will make a protocol or plan for your review. Then you will formulate a review question. Then you will define inclusion and exclusion criteria. Then you will search or locate studies in databases or other places. And then you will select the studies from your results of the search. So after selection, you will assess the quality of the studies you have collected. So the next step is to extract data, and then you will analyze or summarize the extracted data, and then synthesize the data. And at the end, you will present the results in a results section of your paper, and you will interpret. It means you will give a discussion section. So what will be the implications? What are the results? What will be the possible reasons? So the interpretation section is like the sections of the other empirical studies or articles or even theses you have seen. So we will move forward one by one, step by step. So first of all, you should make a review team. So normally a systematic review is a teamwork. So it doesn't mean that a single person cannot do it. A single person can also write a systematic review. It is better, and it is a practice in the world, that systematic review is written by more than 2 or 3 persons. So make a team. So during making the team, you will see the skills. So different types of skills you need in your team. So first of all, managing research projects. So it is a research project like other projects. So it is not empirical in nature, but it is a literature review, but it is a project. So leading skills, coordinating skills, you will see in your team. The next is expertise in the topic. So it is very common that the person from library science or from information studies area give hands to the person with some specific interest in some specific area of health sciences or any other science. So the expert of systematic review may be different, and expert in a particular area is necessarily different. And you will find you will need methodological expertise also. So people with these skills like planning, searching is a specific skill. Managing information, there are softwares, there are tools to manage information. Coding your data, then analyzing, then synthesizing, and writing is always a specific skill you need. So it is better that you will make a team of 2 or 3 or more authors, and then you start a systematic review. The next is protocol. Protocol is a plan. So in the beginning, you will make a plan, and after making a plan, you may submit this plan to different databases. The most common database in health sciences is Cochrane database. You will find it through Google. So Cochrane database collect the systematic reviews and also protocols or plans. So to make a plan or protocol is helpful or is useful to stop you or the others to do the unnecessarily duplicate work. So you will make a plan. It will be 1-2 pages or 3 pages summary of your systematic review, which you are going to do. And this summary, you can put it on the internet. And there are some journals also which publish protocols. You can find it through Google. So in protocol, you will write some basic information about your systematic review. So title, the concepts or the context, and the aim. What is the aim? What is the research question? So what will be your search strategy, and what will be your inclusion and exclusion criteria, and how you will be collect or extracted data, and how you will analyze those data, and how you will assess the quality of the studies. So this kind of information you will include in your protocol or plan. So if you have no plan to submit your protocol in any database, so in this case you can leave this step and you can directly start the writing of systematic review. Then there is a concept of PICO, and PICO is typically related to the field of medicine or field of health sciences. So PICO is helpful to make a research question. So in a typical clinical setting, you may see on these points. So P is for population, I is for intervention, C is for comparison, O is for outcome. So it is called PICO. So population means your patients, you can collect or you can decide their demographic factors or socioeconomic factors or setting, etc. So with the help of this PICO, you can select your question and you can make your inclusion and exclusion criteria as well. So you can delimit your study to a certain age group, to a certain gender, or to a certain area. So one thing I want to mention here, you are going to do a literature review. So you are not going to do an empirical study. So in your literature review, you will select or find the studies. So the PICO will help you to decide your inclusion criteria. So what kind of demographic factors you are looking for in your studies. So you may delimit your studies, your search or your selection. So in population, you may see the research participants or patients. In intervention, you can delimit on a particular drug or a particular procedure the physicians or surgeons have used in their studies. So in comparison, you can delimit your studies in which a comparison is available. So it may be alternative to compare with intervention. So it may be placebo effect or some other active ingredient or medicine or drug they have used. So outcome is the improvement, effect, or measure. So it may be the outcome of the medicine they have used. So look at the example. So you will be able to understand in a better way. Look at this example. Conceptual framework for treating fever. So in this case, look at the PICO population. Children aged 1 month to 15 years with fever or presumed infectious origin. Fever is defined as temperature of 37.5 degree centigrade or more, or 38 degrees centigrade or more, core body temperature. One moment, please. So yes, please. So look at the intervention. Intervention in this case is paracetamol, and comparison is placebo or physical methods to decrease the fever of a patient. Then outcomes is the return of the temperature to normal. So in this case, the authors have made this PICO to see the effect of paracetamol on the patients. So the effect will be measured in the form of the decrease in fever. So temperature should be normal. So in this systematic review, they have seen that in which studies the effect of paracetamol can be seen. So at the end, they can make a systematic review, or they can convert their study into a meta-analysis. So sample questions. So look at these questions. You can use these questions. So luckily, all these questions are from health sciences. So the first question is, in undergraduate medical education, does the user of clicker technology in the classroom improve learning outcomes? So clicker technology is like a remote in the hands of the students, and they can use those remotes to answer questions or to do their quizzes mostly. So another question is, are antiseptic washes more effective than non-antiseptic washes at preventing nosocomial infections in patients undergoing surgery? Another question is, are mass media or school-based or community-based interventions effective in preventing smoking in young people? So the question, the research question or the review question is the most important part of a systematic review, because all the review, all the steps are based on, are grounded on this question. So this question must be very, very clear in its nature and in its statement. So look at the inclusion and exclusion criteria. There is an example. So look at the inclusion paragraph and then exclusion paragraph. So we are going to find, means search and select and review some studies in our systematic review. So for that purpose, we need inclusion and exclusion criteria. So in this case, we will search and find and select only English language studies. So the researches were done in UK on this topic. The time scale was 2001 to 8. We will also include the grey literature. Grey literature actually is the literature that is not normally available through regular or through formal sources. So these are reports or non-academic research, or these are posters, or these are flyers or brochures. So these are pamphlets, and we will include also Google Scholar. So exclusion criteria is the studies will be excluded in which the patients or participants were outside UK. So these topics will be excluded, and the studies published before 2001 will also be excluded. So we have to make a clear and explicit inclusion and exclusion criteria. So normally in a systematic review based article, we include the inclusion and exclusion criteria in the article. So there must be a clear research question and inclusion and exclusion criteria. So the next step is searching literature. So literature search. You have decided your question and inclusion and exclusion criteria. So always keep those two things before you, and you decide for searching. So for searching, first of all, you will have to identify the major concepts included in your systematic review. So first concepts, then you will convert those concepts into keywords. So which keywords you will search in the databases. So what are your keywords? What are their synonyms? So you may use controlled vocabulary. Controlled vocabulary means there is a list of subject headings or keywords you can use in a particular subject area. For example, in health sciences, there is a medical subject heading mesh. Mesh is a controlled vocabulary tool in the health sciences. So if you go to any database of health sciences or any library of health sciences, so they normally use mesh subject heading or controlled vocabulary system. So you can see this controlled vocabulary tool on the website of databases like PubMed, etc. So you can combine the concepts. So there are some specific techniques in searching methods to combine the concepts. So Boolean operators is a technique, string, truncation, proximity. So these are the techniques. So any librarian can help you in this regard, or you can include a librarian in your systematic review team. So they are normally trained and they are expert in these searching techniques, and then identify where to search. So which databases you will include, where do you search the studies you want. So after that you make a search strategy. So search strategy is that statement which you enter into a database to search your required results. So, for example, if you go to PubMed, so you will type something. You will type a word tumor, and you will use Boolean and tumor and Pakistan. So these are two of your keywords, and you have used and as a Boolean operator. So so this statement, tumor and Pakistan, so this statement is called a search strategy. So search strategy can vary in different databases. So but you will be very careful in using search strategy. So it should be according to the database you have used. So I think in today's program, Mr. Ghulam Fareed will tell you something regarding searching techniques or searching some studies in databases. So after searching, you will export your citations or the basic information a database provides to a reference management software or citation management software. So there are many software packages you may use, EndNote or Mendeley or some other software are also there. And particularly Mendeley software is free of cost. So after that, you will document your search process, all the search process. So the database which you have used, the date of searching, the number of results you got. So the every step of searching, you will write it down in your notebook. So this is the steps of searching literature. But again, in searching literature, you will need some sources of literature. So there will be many of different kinds. There are general as well as subject databases. In general, you will find Web of Science, Scopus, Google Scholar, and in specific in your health sciences area, the most common is PubMed or Medline. It is called Medline also. So in gray literature, you will find conference proceedings, theses, reports, and you will find some stray websites. So you can browse the issues of the journals which are published on specific topics. So those are called topical journals. So you can do backward and forward citations of the most relevant articles. So backward citations are the citations at the end of the article or references at the end of the article. And forward citation, you can use a citation database like Google Scholar. So if you search an article on Google Scholar, so Google Scholar will provide you the link to the articles which have cited this particular article. So in this case, I have written the word forward citations. So the key studies or the most relevant articles you should keep in your mind, and you should go all the relevant articles through backward and forward citation studies, citation search and citation method. and you can have a conversation with the experts in that topic in your area or globally anywhere. So these sources of literature will help you to find studies which you are going to include in your systematic review. So look at a search strategy. So here is an example. You can see the keywords. So the highlighted or bold face words are keywords, and the keywords have been combined with the Boolean operators. You can see at many places or, and. So these are Boolean operators. So the keywords are also specified through field descriptors. You can see DE, AB, TI. DE is descriptor, AB is abstract, so TI is the title. So this is a typical example of a search strategy. This example is taken from ARIC. ARIC is a database in educational sciences or education. Here is another example of search strategy. So this example is taken from PubMed or Medline. It is the largest database of studies in health sciences. So you can see the search 1, search 2, search 3. So these are the keywords. Then in search 9, all these searches have been combined with the Boolean OR, and at number 10, again the Boolean NOT has been used, and 11 also study 9 minus or not study 10. So this is a typical example of search strategy. So search strategy is an important part of systematic review, and you write down the strategy and you will give it in your article. So here is an example of record keeping log. Record keeping log. So you will record everything. So look at this. It is ARIC database. Then from which platform this database has been contacted. So date of search, who has done this search, time frame, number of records obtained, and search string or search strategy. So which search strategy has been used in this search. So you will keep log in this case. So you can note it down, or you can use WordPad or MS Word for this purpose. Then the next step, you have searched and you have downloaded the citations. So now you will select the studies for your review. So in this step, an initial assessment that occurs following the search. So you will do an initial assessment that what kind of studies I have collected in my reference management tool, reference management software. So it addresses the question, should the paper be retrieved? So you first assess, for example, you first assess the titles of the studies. Then you will see or have a look on the abstracts of the studies. So a title and abstract will help you that you should go for the full text of the paper, it is needed or not. So it is essential to use two assessors in both the selection and critical appraisal. If you have a team, so you can use two or more members of your team for this purpose. So there will be less risk of error in this case. Select only those studies that address the review question and that match the inclusion criteria. So normally in your searching process, you will find many irrelevant studies or many studies which are not able to meet your inclusion or exclusion criteria. So those studies are useless for you. So you will scan titles and abstracts, and if uncertain, if title or abstract will not help you, so in this case you should go for full text, and reading the full text will help you that the study is useful for you or not. So you have selected the studies, and all this process, so from searching to the selection, will be shown in your paper in the form of a flow diagram. So I have used word PRISMA here. So PRISMA is a document, is a guideline for writing systematic reviews. So the PRISMA guidelines provides a sample of such type of flow diagrams to us. So if you look at the diagram, on the left side, you will see the 4 areas or 4 components of this diagram: identification, screening, eligibility, and included. And in the diagram, it starts from the results of the searching, and then we excluded something, again excluded, and at the end, we have selected the studies which we are going to include in our systematic review. So there are some other examples also which will explain the concept to you. So PRISMA diagram, I have taken it from an article. So look at this from left side, from top. You have started your work, then you have read abstracts and titles, and on this basis you excluded many articles from your study. Then you have gone through the full text, and again you have excluded, and it starts from thousands of articles, and at the end the authors have selected only 25 articles to include in their systematic review. So after making a flow chart or a PRISMA flow chart, so you will do another step, study quality assessment. So you will find a checklist for this purpose. I will show you the examples also. So in health sciences, there are many checklists. So if you are from any other field, so you can find a checklist, or you can make your own checklist to assess the quality of the study. So at this stage, it is again better to use more reviewers or more members of your team. So the error of bias or error of doing wrong will be minimized. To look at the example of quality assessment criteria. So for each study, for example, in previous example, we have seen that 25 studies were selected for review. So for those 25 studies, for each study, you will do this assessment. So title, abstract, introduction, methods, in methods, further subdivision. So you will read the full text, you will find the title, abstract, or other parts of the article, and you will assign some marks. So title is accurate, appropriate, abstract is appropriate, sampling technique is appropriate. So it is a controlled randomized trial, or it is not. So you will assign some marks. So after getting marks, this kind of table you will have. This kind of table. So look at this. On the left side are studies. So on the right columns, the marks are there. So from 1 to 20, these are the points in criteria. And at the end, the last column is the total of the marks. So in this example, which study has got the maximum marks? Maximum marks, how many? I have seen 29. 29 marks are the maximum, yes. So 29 marks were given to the third one. So Pellegrini et al. 2013. So this study has got. So this study is the strongest evidence included in your review. So the next step is data extraction. So you will read the study and you will find the information related to your question, your research question, and you will make a table. You will extract data and make a table. So for extraction of data, you will use a form. So you can use a form in the printed format, or you can use this form in Excel or in MS Word. So look at the example of the form. So this is data extraction form. General information regarding the study, then specific information, then outcomes. So the outcomes is related to your research question. And the first two components of this form related to the general or specific information regarding the study, regarding the paper. So who is the author, what is the year of publication, what is the journal, in which country the study have been conducted, in specific information, what was the study design, what was the sample, so any other issues. So in outcome, you will focus on your research question, and regarding that question, you will collect the information. What was the prevention, intervention, and duration, and other information. So you will make this form according to your need. So after filling the forms, you will present the information in this format. It is a table. So in this table, you will see the first column is reference. Normally it is the author's name, author's last name and year in parentheses. Then aim of the study, aim of the research, then focus and location, then method used. So all these four columns are related to the study itself. And the last column is related to our research question. So in this column, you will write the answer to your research question. So after making this table, you will analyze first. So the analysis part was done in the form of this table, and then the step of data synthesis. So you will synthesize, or you will collect everything, and you will summarize your data. So will results be pooled? How results? How you will combine the results, and how will differences between studies be taken into account? Can subgroups of data be made? How will results be displayed? So this is a part of synthesis. You will synthesize your results. What is clearly seen in the results of all those studies. So after data synthesis, you will write the discussion part. So discussion part is just like writing this part in other articles or in thesis. So I have not made a slide on this part. So also after that, you will write an article, and you can send this article to the journals. In health sciences, many journals have specified a section for systematic reviews. So you will go for publishing your review. So my slides are finished here. So now I will show you some examples of systematic reviews. So some samples, for example, so this is an example from psychology. In the field of psychology, look at this article. Effects of war, terrorism and armed conflict on young children, a systematic review. Title, names of the authors, abstract, then introduction, keywords, introduction. So method. In method section, you can see search strategy and selection criteria, then data extraction and quality assessment. So look at the PRISMA flowchart. So in this study, they started their work from 892 findings, and then they reached at only 35 studies for inclusion in this review. So the quality assessment results. So then they have given the answers and they have discussed the results of the studies. So they have made a table also. So look at this table. This is a data table. I will show you another example. I will show you an example of meta-analysis. I did this meta-analysis a few years back. Correlation between perception-based general rankings and the general impact factor, a systematic review and meta-analysis. So the title, author name, author affiliation, abstract, keywords, introduction. So in methods, you will see the focused question, eligibility criteria, search strategy, selection of studies and data abstraction, data synthesis and meta-analysis. So look at the flowchart, PRISMA flowchart. In results, description of studies, then meta-analysis results, then discussion. So look at this table. So this is the data table. First of all, study, then disciplinary focus, in which area this study was conducted. So this is some method information. So number of journals correlated to general impact factor year. So in the end, this was my question. So is there a correlation between two methods? So I have collected Pearson R, Spearman, Rowe, etc. And the next part, you will see this figure is related to meta-analysis. So look at this red point. So this is the result of meta-analysis. So in this paper, I did a meta-analysis and systematic review. Okay, so the both part are included in this study. So I will show you another study. Yes, look at this. I did this study with the co-authorship from Dentistry College. So So the first author is a dental surgeon, and second name is mine, and the third author is again a professor of dentistry. So it has been published in a dentistry journal, Impact Factor journal. So look at this study. So PRISMA flowchart. We started our work from 342 articles and included in this study only 9. So 9 studies met our criteria, and then this table shows that the reasons for exclusion of the other studies. So these are the 9 studies we have included. So these are the quality scoring of these 9 studies. So from 1 to 20 points in the criteria. I will maximize this. 1 to 20 points in the criteria. At the end is the total score. So the best study among our 9 studies was at the total scoring of 34, the last one. Park C et al. 2012. So this study was best in its quality. Results. So discussion like other articles, conclusion, references like other articles. So now my presentation is finished now. So Mr. Freed, if we have time, so we can invite questions. Yes, please.
Thank you, Professor Khalid, for such an enlightening presentation. I would like the participants now to please ask the questions.
Yes, please, if you have any questions. So,
Doctor, first question is from my side. Like you have, identified a checklist to assess the quality of it, and
yes.
who will determine that items of checklist, and who will determine the score?
We find the authors have made it. The previous authors have made it, and you will find it from internet or from any book of on the systematic reviews, or in health sciences it is very common. You can find many, so you can use anyone. It's up to the author.
This is a question from Bakas Rabbani, and he is asking that where does scoping review lie, at what level, and then what's the difference between it?
Scoping review is a different thing. Scoping review is not a systematic review. Actually, scoping review is a different kind or different type of literature review. So I will tell you something about that. If you show an introductory, or if you want to show the literature on a specific topic, so you will not write a systematic review. You will write a scoping review. So scoping review is normally about the new topics, the word. So you will show in your review that which kind of studies are available on this topic. So actually the scoping review is not dealing with a particular research question, it is dealing with a particular topic only. So,
there are many questions.
Yes. So scoping review
another question.
Yes, please.
There is a question from Ansa Rabia. What is the minimum duration of studies to be included?
Minimum duration of the studies. So it depends on the topic, and it depends on the. I think they have asked about the time frame of the study. Time frame means
Yeah.
yes, which studies have to be included in the literature review. So it depends on the research topic or research question. If there are many studies on that question, so you may delimit the study only on the few years. So, for example, if there are many articles on a particular topic, for example, you may find 100 or more than 100 articles on a topic. So you may delimit your study to the last 5 years, last 4 years, even last 1 year. It depends on the.
अतिया, हाँ जी, आप फोन तो नहीं कर रहे थे मुझे मेरे मोबाइल पे? अच्छा चलो, वो लगे हुए थे मुसलसल, तो मैंने बार बंद कर रही थी, तो मैंने कहा शायद आप ना कर रहे हो.
So please,
Dr. Mariam, please unmute.
So it depends on the availability of the literature and your question. So you can make any delimitation criteria for you.
So it is not necessary that we must include the last 5 years or last 10 years. Is there any,
No, there is no rule. There is no
include
rule.
any?
No, you can include any. It depends on the question. It depends on the objective of your study.
So there's another question from Kashif Bhatt, and he's asking number of minimum references in the review.
डॉक्टर अंसर आबे जो है ना, अगर खुद भी क्वेश्चन करना चाह रहे हैं तो बेशक वो कर सकते हैं, उनको अलाउ कर दिया.
ये जो खुद भी कर ले. नंबर ऑफ क्या, ये मुझे दोबारा बताइए.
Number of references. Minimum number of references.
नंबर ऑफ रेफरेंसेस का भी क्राइटेरिया नहीं है. देखिए, नंबर ऑफ रेफरेंसेस जो है ना, देखिए मैंने आपको स्टडीज दिखाई है ना. एक मैंने आपको 25 की दिखाई है, एक मैंने आपको 9 की दिखाई है, और वो भी इम्पैक्ट फैक्टर जर्नल में पब्लिश हुई है. एक मैंने जो स्टडी अपने लिए, तो मैंने उसमें 53 शामिल किए थे, तो 53 वाली भी पब्लिश हो गई थी. असल में डिपेंड करता है कि आपका रिसर्च क्वेश्चन क्या है और उस पर अवेलेबल लिटरेचर क्या है. अगर लिटरेचर बहुत ज्यादा होगा तो आपके लिए मैनेजेबल नहीं होगा. आपको अपने क्वेश्चन को नैरो डाउन करना चाहिए. अब नैरो डाउन करने के लिए आप उसका टॉपिक नैरो डाउन भी कर सकते हैं, उसकी कोई ब्रांच ले लें, पूरा क्वेश्चन ना लें. दूसरा तरीका ये कि आप उसके नंबर ऑफ ईयर्स या कोई एरिया आप स्पेसिफिक कर लें, कि अगर आप हेल्थ साइंसेज में कुछ काम कर रहे हैं तो आप कहिए मैंने सिर्फ पाकिस्तान की स्टडीज देखनी है, मैंने सिर्फ साउथ एशिया की देखनी है. अच्छा, ज्योग्राफिकल डिलिमिटेशन से भी आपका काम हो सकता है. आप जो है ना वो पीरियड वाइज भी डिलिमिट कर लें, और इस तरह से ये होगा कि आप जो है ना वो एक लिमिटेड नंबर आ जाएगा. लेकिन मैंने ऐसी स्टडीज भी देखी हैं जिसमें सिर्फ 3 स्टडीज शामिल हुई हैं, और वो सिस्टमैटिक रिव्यू. टॉपिक ऐसा था करंट, लेकिन स्टडीज बहुत कम थी, तो 3 स्टडीज को शामिल करके सिस्टमैटिक रिव्यू छपा हुआ है. लेकिन नॉर्मली क्या होता है कि 10 से लेके तो कोई 35-40 तक, क्योंकि 35-40 से ज्यादा फिर मैनेज करना मुश्किल हो जाता है, वो स्टडी बड़ी हो जाती है. और कोई क्वेश्चन आप?
There's another question from Mukas Rabani, and he's saying that presenter was saying something about getting registered your systematic reviews. Can you please elaborate on it?
जी, ऐसा है कि वर्ल्ड वाइड आपको डेटाबेसेस मिल जाएंगे कि जहां आप अपने सिस्टमैटिक रिव्यू, बल्कि सिस्टमैटिक रिव्यू का रजिस्टर आपका प्रोटोकॉल होता है. आप जब काम अपना स्टार्ट करते हैं तो प्रोटोकॉल आप बनाएं या प्लान बनाएं, और वो प्लान वहां रजिस्टर करवा लें. तो एक तो मैंने कॉकरेन की मिसाल दी, और भी हैं. आप सर्च करें गूगल पे तो आपको रजिस्ट्रेशन के आपको डेटाबेसेस मिल जाएंगे. वहाँ पे जाके आप जो है वो अपनी इंफॉर्मेशन डाल दें. उसका फायदा क्या होगा कि कोई नई टीम अगर उसी रिसर्च क्वेश्चन को लेके काम शुरू करना चाहेगी तो पहले वहां सर्च कर लेगी. और ये काम आप खुद भी कर सकते हैं कोई टॉपिक सोचते हुए कि पहले वहां जाके उन डेटाबेसेस में सर्च कर लें, ताकि आप कुछ डुप्लीकेट नहीं कर रहे. आपको डेटाबेसेस मिल जाएंगे. कॉकरेन सबसे कॉमन है जहां आप रजिस्ट्री करवा सकते हैं.
Okay, ji. Anyone wants to ask any question? Any questions, please? Okay, thank you so much, Doctor. So it was such an excellent talk and excellent, enlightening, informative presentation by you.